So as you're aware, the meeting will be recorded. So we'll ask that you just leave your questions in the chat or hold them to the very end. We'll have moderators who will collect and respond to your questions in the chat. And if we do happen to run out of time or your questions weren't fully resolved, we will just ask that you just please send your emails to us via email to our inbox, and then we'll get back to you as soon as we can. So, quick overview of the statute that brings us all here today, which is Article 29-K. So, quick summary of the statute. It requires that temp staffing agencies register once per year with our department and report temporary worker information at the end of every quarter. So, this quarterly reporting is part of this package, which is comprised of various items containing financial, geographic, demographic characteristics. If you are interested in looking at the specifics within this statute, I welcome you to visit our website, or you can click on the link in the slides for Article 29 of the Public Health Law. So regarding the reporting deadlines, here are some important dates to keep in mind. Okay, so to remain registered as a temporary healthcare staffing agency, you will need to submit your quarterly reports to us via SendVault. Right now, there is a window of 60 days towards the end of the quarter. So I suggest that when the quarter is over, that you submit your reports as early as you can. That way, if there is an issue that needs to be addressed, it can be sent back to you and returned back to the department within that reporting window, right? So 2 months after the reporting at the end of the cycle. So right now, we're gearing up for the collection of Q1, right? So that Q1 ends in just a couple days on Monday, right? And so just also be aware and be on the lookout that following Q1, we'll also be looking for quarterly reporting for the next cycle, which will start April 1st and end June 30th, right? And for those of you who are keenly aware, August 1st, 2025, that marks the new registration calendar year. So please mark that onto your calendar if you haven't done so already. Again, I implore you all to submit your documents early. This gives time for our team to review the documents that you send us. And if for whatever reason we determine that the report needs to be returned to you, or in the case of registration, if there are any documents that are missing that you need to fix, there's ample time to have those things submitted and resubmitted prior to the deadline. And just a friendly reminder that, failure to submit your quarterly reports and register can lead to some serious consequences. So regarding the reporting requirements, the quarterly report is comprised of 5 separate parts. You have the quarterly reporting file, you have appendices 6, 7, and 8, and PDF copies of your invoices. The focus of this webinar will be on the tabs within the quarterly reporting file. So if you have any questions regarding the appendices or invoices that you need to submit, I just suggest that you refer to our website and visit the facts section to learn more information. So the link is provided on this slide below, and we also have additional links at the end of the presentation that you can use. So within the quarterly report, there are 5 tabs that you must fill out completely. Note that when you do open the file, you'll notice 4 additional tabs. Those are just instructions to help you get started on completing your report. I also recommend that you download the latest version of our workbook from our website prior to starting your submission. There have been several agencies in the past that have submitted reports to us using some outdated workbooks, which we unfortunately had to return back to them. We do make modifications to our workbook, including several significant changes that have been made within the past 6 months. Although there have been no recent changes within the last 2 months, I advise that you do go back to our website regularly to check and see if there is a new download available for you. So let's start on the first tab within the quarterly report, and this one is the agency info tab. So on the agency info tab, there are important pieces of information that you must fill out. It's very common for people to skip this step. However, I do highly urge you to fill this out entirely so that we can communicate with your point person in the event that there is an issue or we do need to return your report back to you. Okay. To start, please enter in your agency name in the first column. Let's refer to the first column and cell as cell A3. Okay. Right. Here you want to make sure that you enter in your agency's name. Right. Just below that, you want to select the reporting quarter. For this quarter, well, for the next round, we're looking for January through March or quarter one. Okay. Next, you'll want to fill out your agency ID. So if you were assigned agency TA ID number when you registered, you'll have that information. If you don't know what your TA ID number is, you can find it on our website under list of all registered agencies. Okay. Next, you'll want to make sure you enter in the contact person, the person who will be responsible for this final product. So this is a very important step because if your report is flagged for review, we'll need to reach out to that person. So this information needs to be up to date. So not only the person's name, but then also their email address as well. So if you have a general inbox where these emails go to, just make sure that they are reaching the individual, the point person for your reporting process, so that way there isn't a major holdup when it comes to communicating with us and regarding your quarterly reports or registrations or any other documents. Okay. Also, if you are a vendor management system, you will still need to report. However, we do ask that you just make that notification, make that note on this workbook. So if you are identified as a VMS or vendor management system, please mark yes or no. Okay. Also, if you have at least one temporary healthcare employee for the quarter, please mark yes. If you have no employees during the quarter, then please select no. At that point, your quarterly reporting requirements ends there. Just submit the workbook along with other appendices, contracts, etc., to the department via SendVault. But if you do have at least one employee for the quarter, then we can move on to the next step, which is moving on to tab 1. Okay, so the goal of tab 1, wages and billing, is to collect aggregated data on the healthcare professionals that were employed at a healthcare facility during the quarter. So this includes all healthcare personnel, such as nurses, certified nurse aides, doctors, licensed and unlicensed direct care staff, and anyone who provided temporary services at a healthcare facility. So you want to use the drop-down boxes where provided, or the workbook may be flagged for further review by our analysts. Pretty common occurrence is people will just type in random things or copy and paste things and put them into the cell. We ask that you refrain from doing that. That messes up with our ability to calculate things within spreadsheets. So please use the drop downs where provided. Also, for any third-party placements and transactions that only the agency had invoiced for directly should be entered on tab 1. So the invoicing agency, that's responsible for all data entry per Article 29K. So the same goes for any information that's on tab 3 and 4, which we'll go over in just a bit. Okay. Right. So when selecting a healthcare entity, you will need to select the healthcare entity from the drop-down box. The Excel file allows for up to 200 records for this tab. So if you need more rows, you may copy and paste the extra rows to ensure that they exhibit the drop-down menus. Right? Please note that the drop-down menu is tied to the entity PFI list tab. So at any time, you can refer back to the entity PFI list tab to see if there's the full list of healthcare entities that you are looking for. It is updated regularly, so if you can't find the name of the facility in the drop-down list, you can try going to the PFI tab itself and look for the facility by address. And if that still doesn't work, you can always choose the other not on list PFI 99999 option if you are unable to identify the healthcare entity. Okay, again, just puts into words what I just recently stated. One thing I do want to point out is that this entity PFI list tab is its own separate tab. It has a complete list of all of the New York State healthcare entities that are registered with the state. Okay, so again, if you cannot find that information on the tab, please use other not identified. You can also try to narrow down the healthcare entities by just simply typing in a few letters of the entity name within column A. So this should help ease the data entry aspects of the workbook. So you don't necessarily have to know the PFI number itself. You just need to know the facility name, and that can be enough. Okay. So under the job category column, there is a list of job categories in this column B. So here you'd select from the list in the drop-down menu all the options that we have. You can select other not listed if the specific job title or a similar job title is not on a list. And so we have a total of 10 different categories here. Right. So after you've selected the right job category, you'll want to make sure that you select the total number of employees in that job category. Okay, so again, after you've gone into the workbook and you've selected the right job category, you'll want to make sure that you enter in the total number of employees for that particular job category for that particular healthcare entity. Okay, and we're going to go over a little bit more detail about that in a little bit when we do the demo. But just the main point that I want to drive home is that this is broken down based on entity, category, and total employees in the category, as well as the pay type or benefit. Okay, so there are multiple breakdowns here that you'll need to stratify your reporting based on. Okay. So next in column D, you'll want to make sure that you enter in the worker pay type or benefit. So each pay type needs to be added to a new row. So for instance, if the worker received regular pay or overtime and lodging and meals, then those need to be reported on separate rows. Okay. And so here are the different pay types or benefits. Right, you'll want to select a pay type or benefit that was paid to the worker from the drop-down list. Employer paid health insurance premiums or other bonuses can be entered in as other fringe benefits. And just please note that you must report the various pay types for every job category at every healthcare facility. Okay, that's important. So if you have 5 different facilities, we would expect to see at least regular pay. There may be instances where some of your workers may have overtime pay or hazard pay, weekend differential. They have their own lodging and meal costs or other benefits. Those need to be included on separate lines for those workers. But again, it's aggregated, right? So if you have, for instance, 2 people doing overtime pay and they're both doctors at the same hospital, then enter in the aggregate of the overtime pay for those workers. Okay. So next you'll want to enter in the total number of hours worked for that pay type, and that's going to be shown in column D. So you'll want to enter in the total number of hours worked for that specific pay type. Um, However, you can enter zero for pay types that are not calculated by the hour. So that'll be things like travel related expenses, lodging and meals, or other fringe benefits. And also, please do not enter negative values in the column. Okay. So looking at it here, an example here, these are the total hours that are worked for instance, in row one, you have 100 hours of regular pay across 3 employees who are registered nurses at Bronx Health Center. Okay. If you look further down in the column, you'll see here in this other not on list PFI, there were 5 registered nurses in this and certified registered nurses in this category that received other fringe benefits. The total hours were 0, but then here they have reported the employee compensation and what was billed. Okay. So in this total employee pay or benefit column, please enter in the total amount paid or expected to be paid to the healthcare worker for the hours that were worked. So again, this is going to be aggregated costs by the pay type and facility. And we just ask that you enter in the amounts that are to the nearest whole dollar. And so please don't use commas, periods, or dollar signs. So once again, we expect that you're going to report using the accrual accounting method. And so that requires users to report the amount earned by the employee for the hours that they worked during the quarter. And that's going to be regardless of whether the employee was actually paid during the quarter. So an example of this would be employees who are paid on a 2-week lag, where at least one of those days extends slightly beyond the end or right before the end of a quarter. And also, again, don't use periods or dollar signs. Just enter in values to the nearest whole dollar. Okay. So in column G, you're going to enter in the total billed or expected to be billed to the healthcare entity for the job category and pay type for the hours that were worked in column E. So if no hours were reported in column E, then you'll just need to enter in the total billed or expected to be billed to the healthcare facility. And also remember that there are no missing values in these columns. So if the answer is 0, please put that. Okay. So just again, showing you what these numbers should look like in this column. Again, there should be no 0. There should be no missing cells, right? You can include 0 if it's not something that you build the healthcare entity for. Okay. Oh, and just going back. So important final notes about tab 1. If you do have any payments that were made to a worker, please report that. If none of those drop-down menu options for pay type apply, then please select other fringe benefits. Okay. Also, if you build the healthcare entity for anything, please put that dollar amount that you billed for, even if it is less than what was paid to the healthcare worker. So some problems that we have seen in the past are that there are multiple entries for regular pay with the same job type at the same facility in column A. To make this a lot easier on yourselves, just make sure you combine them, especially if you do have multiple healthcare entities and or other job categories that are not not on the list. All right. So if you have multiple facilities that don't fall into the healthcare entity list and you have to use one of these, just make sure you just collapse that information based on the job category and pay type. So even if you have 4 different entities that fall into this category and you have multiple physicians across those different entities, you can just combine that based on the job category and the total number of employees, and then you just report out based on that aggregate. Okay. Right. So let's move on to tab 2. So tab 2 is for the revenue and expenses tab. Right. So here we ask that you just enter in the total revenue and expenses for sending temporary healthcare employees to New York State for the quarter. You do have the option to provide subcategories for revenue and expenses. There are going to be certain expenses that you may include, but are certainly not limited to. Here are some examples that we've provided. You do not have to use these. These are just examples, but some of these could include things like total revenue from per diem add-ons or service fees. Regarding expenses, these could be things like rent, utilities, equipment, supplies, insurance policies, and salaries and benefits to agencies, administrative staff, and so on. Okay. One thing we do ask though is that you do include some descriptions of the revenue and expenses as needed. So for instance, if there's something under other revenue that uh, someone outside of your organization has no context of what that information is, please provide a description that explains what those charges are for. That way, if we do have questions, it'll be a lot easier for us to just go back to your description and review. Otherwise, we may have to send the report back to you to ask for a better explanation of what those expenses or revenues breakdowns were. Okay. Tab 3, moving on, collects location information on the worker's primary residence as well as their work location. Right? We also ask that you do this for specific job categories as well. Okay, so we'll need to know what that person's primary residence state is, their zip code, where they're working, and then what job category they are working. So this will be so for every worker you have, they will have their own independent row. Right? And not much to be said here about tab 4, international. It's pretty much the same, where you're just going to be reporting that person's home country, their primary work location, and then what their job category is. Okay. Okay, so let's walk you through a demo of what we are looking for. So just give me one moment while I pull that up. All right. So, all right, let me demonstrate a report that shows what we're looking for in our submissions. So hopefully this will provide a good visual for those of you who would prefer to learn that way. So the first tab of the workbook is the agency info tab. Here's where you're going to put all this important information, like I had mentioned before, right? So this is where you're going to type in your agency's name. There's a drop-down menu for the quarter. All right. So again, we're looking for Q1. So this will be January through March. Here you're going to type in your TA ID. There is not a drop-down menu for this. So if you do not know what this information is, again, I ask that you just go to our website and look that information up based on your agency's name. Okay. You're going to put the person's who is responsible for submitting this report's name here, as well as their email address, okay, and phone number, right? And you're going to report whether or not you are a VMS application. If you are, select yes. If you're not, or you do not know what that is, select no. And again, if you do have at least one temporary healthcare worker, you do want to hit the yes button, and that will allow us to decipher whether or not you need to move forward with the additional tabs. Okay. And just to point out, after you're done with this slide, there are additional tabs for instructions that gives a little bit more explanation of what each of the columns are looking for. So I invite you all to, when you download this workbook, that you just take a look at the instruction tabs before you move on to the reporting tab. Okay. So when filling out this spreadsheet, there are important things that you need to take into consideration. Like I mentioned before, this information is all based on the aggregate across the healthcare entity, the specific job categories within that healthcare entity, the pay type of the job category within the healthcare entity. Okay, so across those three levels, this is how you're going to be reporting. And you're also going to want to include the total number of employees within that particular category for the particular pay type or benefit. So in this example that I have set up here, we have 3 registered nurses that are working for Bronx Health Center, right? PFI 15657. All 3 received regular pay for a total of 100 hours, and this was their total pay out to the workers, and this is what was billed to the healthcare entity. Okay, again, no commas, no dollar signs, no cents. Everything's rounded to the nearest whole dollar. 2 out of the 3 registered nurses had overtime pay for a total number of 40 hours, and then this was the pay that they received, and that was billed to the healthcare entity. Now, I'm sure some of you are probably thinking the total hours and pay and all of that may not be representative of true data, but these are just examples here, just to show how the information should be entered. Okay. So with that said, as you scroll down, you'll see that there are, for all the different healthcare entities that someone is working in, you're going to then go move across each row to add in new information. Okay. So say, for example, I have a person who is employed at Cuba Memorial Hospital. I select from the drop-down menu that this person's a physical therapist. There's just one person in this job category, and then I'm going to enter in their regular pay, and they worked a total of, say, 10 hours for the quarter, and I paid them $5,000. All right. Maybe what I billed the healthcare entity was 7,000. That's hypothetically, right? Okay, so next what I have to do is then go to the next line, right? I can choose to type in Cuba Memorial Hospital, and then these will pop up, all right? One question that we did get earlier was about what do we do when we have hospitals that are the same name but different PFIs? In this case, this database is not owned or controlled by us. So there are going to be some there are going to be some overlaps or things that might have made their way into this file that we have no control over. So the recommendation we have is to just choose the first one, choose the option that's closest to what you're looking for. So in this case, for Cuban Memorial Hospital PFI 37, we're just going to go with that one, right? Again, for my physical therapist, I'm going to make sure I select my physical therapist. I just had that one person there. And then they also received lodging and meals. For this, I'm going to enter in 0 total hours, and I'm going to give them the amount that I paid them for their lodging and meals. And then I'm going to enter in the amount that I billed the healthcare entity for that service or fee. Okay. Again, if the value of the if you build for a value that is less than what you paid the worker, you can still include that. Any amount of money that you build a healthcare entity, please put that in this list for us, please. Okay, so once you've entered all of this information across all of these rows, the next step would be to move on to tab 2. But before we do that, I just want to quickly point out just this tab 1 entity PFI list real quick. Okay, here. So here's the list of all the healthcare facilities and entities. So if you're having a hard time, you're in tab 1 and you're having a hard time finding the name of a healthcare facility that you're trying to work for, it doesn't pop up. You can come to this tab and you can try to search by the address, or you can search by the healthcare facility name, or if you do happen to know the PFI, you can also do a quick search, right? So you can hit the Control F function, and then you could do a find on a particular number. So say if I'm looking for this number, or 1, 2, 3, 1, 1243, find the next one, and then here it is. All right, so here's my Split Rock Rehabilitation and Healthcare Center, based on this PFI and the address. Okay, so that's the easiest way to utilize this particular tab. All right, so we're gonna move on to tab 2 now. Okay, so with tab 2, you agencies, you must report a full disclosure of all charges to the healthcare entities, which we're going to refer to as revenue, right? And then compensation to the employees or or any other expenses, that'll be referred to as expenses. Okay. So we also require that you just do a description of those different things that you may lay out. Okay, so in this case here, the total revenue for our company was 800,000 for the quarter. We received 750,000 from contracted healthcare entities, and we received other revenue per per contractual agreements that were made from fees. Okay. One thing to take in mind is that B2, cell B2, and cell B15 are automatically calculated. So please don't go and enter in any numbers here. It'll automatically add up anything that you enter into these cells here. Same thing down below. If you enter in anything into these cells, it'll automatically be calculated for you, so you don't have to worry about entering in any information in there. So let's move on to tab 3. Right, tab 3 and tab 4, I think are pretty straightforward. Again, you're going to enter in the worker's primary residence, their zip code, where they are working in the state, their county, and these all have drop-down menus for primary work location and for state. Zip code is something you're going to have to enter in manually. And then for job category as well, you're going to also utilize the drop-down menu for the job category. Right. And then for tab 4, again, like tab 3, you enter in that person's home country. There is a drop-down menu of all the various countries, as well as the counties. Okay. And then also the job category as well. You're going to make sure you include that for every person who is an international worker, whether that be through a visa or some other work status that they have for this country. Okay. All right. So here are some resources that I mentioned earlier. This is our website. You can always refer to this if you have any questions. You can always look at our facts page. If there are things in our facts page that you are still having questions about, you can feel free to email the department. Our email is tempagencyregistration@health.ny.gov. And then I'll leave you with this one final tip. So our website, it does contain the link to the quarterly reporting Excel file. If you are having trouble with downloading this file, I suggest that you do speak to someone from your IT department so that they can assist you with that. if you don't have an IT department or someone, excuse me, or someone who can help you with that, one suggestion I do have for you is to maybe try clearing out the cache in your browser before downloading this file. One thing I have observed in the past is that when someone's cache is full and they try to download the latest version of this file, they still retain the old version of the file when they open it. So if you are having trouble, like I said, downloading this file, try clearing out your cache or asking someone for some IT assistance. All right. And so with that, I know we have a lot of questions that have been raised throughout the chat, and some of them have been asked. But here's our formal question and answer segment. So, Carrie, I'll turn over the virtual lectern to you.
Thanks so much, Al. You did a great job.
Thank you.
You guys all muted? Okay. We are taking a few questions in the chat, but I think we're almost done. So if you could just give us about 5 more minutes. Thank you.
All right, sounds good.
Hi, Al. Looks like we have quite a lull. Pete put in the temp agency registration at health.newyork.gov. We will expect to receive some emails tomorrow and get back to everyone as quickly as we can. But I think we are all set. Thank you so much. Yes, the recording will. Are we sending the recording out?
Post it.
We'll post the Q&As. Okay, yes, we will post the recording to our website. Okay, Evan will answer your last question, and then we will sign off. Hold on one second, Al, before you.
Yep, sure.
Hi, Evan. I just wanted, I'll put it in the chat so that we'll have a record of it. But you can look on our website and see the final reports that we have uploaded. There's 2 quarterly reports posted that provide the information that we have collected and what we're reporting and using it for. Thank you.
Okay, so
Thank you. I think that's it. We're just going to put the website one more time, and we hope you enjoy the rest of your day. Bye-bye.
All right, thank you all for attending. Please, we have a webinar, we have a survey, if you don't mind just filling that out for us so we can try to retain the value of doing these webinars for you. So that information that you can provide to us will be very helpful. Thank you all and have a good day.